I'm Michelle from MJ Training, and we're just going to go through basic CPR. So first off, I'm going to go through the scenario as if it's one of your own family members and you have not got a face shield, but you're happy to give mouth to mouth because it's one of your own. Other than that though, anyone else, you would never give mouth to mouth without some form of face shield, face mask. And then when we've had a look at the whole process, we'll then come back and I'll show you the face shields. So from the beginning then, we have our protocol of Dr. ABC, danger, response, airway, breathing, and then if we need to, circulation, as in checking for bleeds, or CPR with regards to a non-breathing casualty, and we'd start our compressions. So from the beginning then, check for danger, make sure it's safe, no one's going to jump out on me, no wet floor, no electric, etc. Hello, my name's Michelle, I'm a first aider, you okay? Can I have some help please? Come on, open your eyes, open your eyes. I need a defib. Just going to check your breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Not breathing, get my phone, make my call 999 or 112, put it on speaker, open up clothing. Can I have some help please? I need an ambulance. I've got one adult here who's not breathing. I'm at MJ Training, 205 London Road South, Lowestoft, November Romeo 330 Delta Charlie. There we go. Okay, so with an adult we always start with the chest compressions because generally with an adult the heart's a problem, but they've got plenty of oxygenated blood normally still in them, so let's pump that around. So 30 compressions, 2 breaths, 30 compressions, 2 breaths. So with our chest compressions we aim for the centre of the chest. So the collarbone's the top of the chest and the ribs here are the bottom of the chest. So generally around the nipple line is the centre of the chest. We don't want to be too low because we've got a little bit on the bottom of the ribs here will break. So we just need to be right on the centre of the breastbone. Ideally push in with the heel of your hand. You can do this, okay, so you'll bring your fingers up, push on that heel of your hand, lock your arms straight, shoulder directly over. I find that quite difficult now because I've been doing this for years, so I find that a lot more comfortable. Again, bring your fingers up, so you're just pushing on that part on the centre of the breastbone, okay? 30 compressions at a rate of 100 to 120 beats a minute. So that's basically 1, 2, 3, 4, tick, tock, okay? And if you lose count, don't panic over it. When you think you've done your 30, go on to your 2 breaths, back to your 30 compressions. But the trick is we do need to make sure we push down far enough, so 5 to 6 centimetres, that's quite a distance, and we do need to let the weight off as well, okay? So we don't want to bounce up and down off the chest like that, and we don't want to be doing this either. We need to make sure the chest comes back up so that it draws the blood back into the heart, and then we pump it around again. With an adult you will break ribs, but if you're just pushing on the centre of the chest, the ribs will go down here. So you will hear them go, but just keep going. Better a broken rib than staying dead. Now with the breaths, with an adult you need to move level with the head, so that when you take the head back you're not pulling on the neck or lifting the shoulders up off the floor, it goes back straight. So we need to take the head back with what we call a forehead chin tilt. So push down on the forehead, 1 or 2 fingers lifts up the jaw, and hold it. If we let go, it will start to come back down again and close the airway off. When we take the head back, take it gently back as far as it will go, hold, and get down, listen, look and feel. And you can use your fingers on the head to add up the breaths. Count out loud, because otherwise if someone comes in to help you and you're counting in your head, they're likely to start talking to you, asking you what's going on, and you lose count. If you're talking out loud, they're not going to usually talk to you till you've finished. And if you see the chest come up and down, that's one breath. Up and down, 2 breaths. It's not 1, 2, 3, 4. Okay? All right? And we want normal breathing. So for an adult, we want 2 to 3 breaths in 10 seconds. 1 breath in an adult in 10 seconds, they're dead. They're not breathing. But you have to remember, dead people move and they make noises. So that's what we call an agonal gasp. And that's where you've got the equalising of pressure is pushing air out of the lungs. And if there's fluid in the back of the throat, you'll get a if there's nothing in the throat, you might just get a and also as oxygen's dragged out of the muscles to the brain, you'll get movement in the arms, mouth will open and close, head can move, neck muscles can move. So dead people move, they make a noise. Do not mistake that for normal breathing. Okay? Right, so with the face shields, we got 2 main types anyway. This one here is bog standard stuff you'll get in your first aid kit. And when you open it up, you've got this sheet with the plastic to protect you from fluids and a paper filter. Sometimes you get different styles of filters, but that goes on the face like that. Okay? Once it's on, it ideally should stay there. They don't mind that there's something on their face because they're dead. But generally these will stick to the damp skin. But if they do come off while you're doing the compressions, make sure it goes back on the right way. We still do with this our forehead chin tilt. Still need to pinch the nose. And one of the biggest issues here is people fiddle with this to get it straight. And they push too hard to hold the plastic and they shut the mouth. So if you're struggling to get air in, just hold the bottom of the jaw. Don't push on the neck and don't push on the jaw because you'll push the tongue to the back of the throat. But they're not the easiest things to use. The better one I find is a face mask. You get all different makes of these in blue, green, red, orange boxes, yellow boxes. But with these you push them through. This again has got a filter here, but the casualties air comes out the side. So this goes on the face and you can put the elastic round their ears. His ears coming off. Bad day for this one. And tighten it. And then with these, it's like 2 C's to hold that to the face. Push down with the heel of your hand, lift up with a finger on the bottom of the jaw, and then you can breathe through that. Okay? Right, so what I'll do is I'll just demonstrate once more using the face mask and not the same scenario. So from the beginning then, check for danger, make sure it's safe. Hello, my name's Michelle, I'm a first aid. You okay? Can I have some help, please? Come on, open your eyes, open your eyes. I need a defib. Just going to check your breathing. Forehead, chin tilt. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Not breathing. Get my phone, make my call, 999, put it on speaker. Get my face mask. Can I have an ambulance, please? I've got 1 casualty, an adult, not breathing. I'm starting CPR. I'm at MJ Training, 205 London Road South. Lowest off, November Romeo, 33 0 Delta Sierra. Okay. And just be careful when you do the breathing, don't overinflate the chest. Look out the corner of your eye. As soon as you see the chest move, stop breathing. Thank you.